right, so today we are going to discuss viruses and fungal infections. Yesterday we focused on bacterial infections. So just a reminder, you have your different types of pathogens. You have your bacteria, your viruses, and then your fungal. So viruses are the smallest of the microorganisms. So again, you're going to need a microscope to be able to see them. And then they must be inside another living cell to reproduce. So what this means is they need to have a living host. And so that's what makes viruses a lot different than the other ones, because a virus is actually something that's living, whereas bacteria is not. And most viruses are spread by blood and then also body secretions. So things like saliva, anything that's coming from a mucous membrane. So maybe spit from your mouth. Again, that would be saliva. Anything that's coming from the reproductive tract, your nose, your eyes, things like that. And viruses, unfortunately, are much more difficult to kill, which is why, like with things like COVID, we don't really have 100% like foolproof treatment on how to actually get rid of it. So they're just more difficult because they can rapidly mutate. And bacteria can too, but just know that viruses, I would say, are just a smarter microorganism. And then also a reminder, antibiotics do not kill viruses. So just keep that in mind. If you're ever sick and the doctor prescribes you an antibiotic, unless you know for sure you have some type of bacterial infection like strep throat, just know that the antibiotic might be useless. There are viruses that have infected animals, and then because of this infection of animals, they can then mutate to infect humans. So a couple of examples of this is SARS. So SARS is severe acute respiratory syndrome. COVID is actually SARS-2, but it's a little bit different. So just keep that in mind. I don't think they have figured out whether or not you can transfer the infection to animals. Like your pets, I know they have mentioned that if you are sick, to stay away from your animal because you don't want them to get sick. But I do not believe that animals can pass it to humans. And I don't believe, too, that if an animal were to get COVID-19, I keep talking about this just because it's obviously relevant, that they can then develop the symptoms. I think they just kind of are a host, but they're not going to get sick from it. But other examples would be like West Nile virus. West Nile virus is something that's found in mosquitoes. And so West Nile, again, can cause someone to have severe complications if they have a compromised immune system. Monkeypox would be another one of these. Ebola, Marburg, H1N1. So I'm not sure if you even remember that, but that was swine flu. So all of these different viruses had originated in animals, and then they basically mutated to then be able to infect humans. Hepatitis A, we have briefly talked about when we went over the blood-borne pathogens, but just remember, hepatitis A is actually one of the hepatitis that is not spread through blood. So hepatitis A is not a blood-borne pathogen. This is one that is spread through contaminated food or water. And so typically, this is seen more so in third world countries because they don't have the same filtration systems as we do in America, or other like Western civilizations. And so just the likelihood of getting sick from consuming water is much higher there. And then there is a vaccine for this. And so again, vaccines can help prevent illnesses. And then if you even were to come into contact with it, the vaccine can too also help to reduce the severity of the illness as well. Hepatitis B is another one that we have talked about. This is one of the bloodborne pathogens. So just remember, it comes from, I don't know, not contaminated blood, but blood that has the virus in it. So that's why it's super important if you plan on working in healthcare to make sure that you wear gloves, you're wearing PPE that you need to if you are working with a patient. Like rule of thumb is kind of just to treat everyone that you suspect that they might have a contagious illness or disease so that you don't get it. So, and in general, I know we haven't gone over what hepatitis is, but hepato is pertaining to the liver. And then we've talked about itis. Itis means inflammation. So somebody who has hepatitis basically has an inflamed liver. So again, it's going to affect the liver. The liver is super important for detoxifying your body, filtering it, and it helps with a lot of your digestive organs. So if it's inflamed and it's not functioning correctly, then you can deal with a lot of issues. And then there is a vaccine for this as well. Next thing that we'll talk about is hepatitis C. So again, this is another one of the bloodborne pathogens. This one is more difficult to destroy, and there is no vaccine for hepatitis C. So I always talk about this. My grandma actually has hepatitis C, and she's older. And so how she developed it was my grandpa back in the, I think it was the 70s or 80s. You could still donate blood back then, but they actually didn't screen the blood for any diseases. And so he got a blood transfusion, and obviously they're married. Not going to go into detail with that, but because of it, she then contracted it from him. And for whatever reason, he didn't really have any issue with it, but for her, she did. So um, she had to go to the hospital, I believe, like 10 years ago, and she was pretty sick, but she did overcome it. So, again, hepatitis C is something that is a bloodborne pathogen. AIDS is another one. So AIDS stands for acquired immune deficiency syndrome. So basically what it does is it just suppresses the immune system. Most people who die from AIDS, it's because of not so much the virus, but that the virus has then suppressed their immune system so much that something like a minor cold can then potentially kill them. So again, there is no cure for this. They do have treatments that they can provide for people, like therapeutic medication, things like that. And then obviously these people just need to be more aware of the fact that they could get sicker than a normal healthy person. All right, your fungal infections. So fungal or fungi, they're simple, they're plant-like organisms, and they live on dead organic matter. So what is that? So that could be anything that you kind of see in the normal environment. Yeast, molds, those are different types of fungi. And then they can also cause, so it says can be pathogenic. Pathogenic just means it can cause infection, or it can cause you to have some type of illness, but not always. And then again, antibiotics do not kill fungi infections. You need to use antifungal medications. So I'll give you guys examples of different conditions that can be caused by fungi, but just know antibiotics is not going to be used to treat this. They only treat bacterial infections. So an example of a common fungal infection is athlete's foot. And so the medical way of saying it is tinea pedis. Basically what athlete's foot is you develop some type of fungus on the bottom of your foot. It causes this like scaly, itchy skin. I don't know if anyone in here has ever seen it, or maybe they've had it before. But you think if you, and it's called athlete's foot because you think of an athlete, they're working out, they're probably sweating a lot, and then they're wearing their shoes, their socks. Maybe they don't shower right away. They still have that dark, moist, damp area, that environment that's in their shoe. Again, if you go back to like yesterday's notes, I talked about how all of these different pathogens need a dark, moist environment to thrive. So if you think a sock or a shoe, that's a very good dark, moist place. And so essentially, you might have some type of cut or scrape or whatever it is, but then that fungus gets into the skin, and then it causes you to have just a scaly skin. It's itchy, and it's pretty common. I've seen it several times as an athletic trainer. You just treat it with a topical cream, and just making sure that it is an antifungal cream. And then ringworm is another type of fungal infection. So again, not sure if you're familiar with this, but ringworm appears as like circles over your body. And a lot of people contract it from like laying on dirty gym mats. So that's why it's super important to make sure if you do go work out at a gym that you're wiping everything down. If you wrestle, I know that for wrestlers that are schooled, they have to be pretty hygienic and clean their mats after every use, just because of things like ringworm. And again, it's not an actual worm that's inside of your skin. It's just something that kind of looks like a worm, and it's scaly. And for ringworm, typically a cream also cures it, but sometimes you might need an oral medication. All right, so kind of circling back and wrapping everything up, pathogens, just remember, can cause serious infections. You have what is known as the chain of infection. So you guys will have an assignment coming up where you're going to actually have to break apart this chain, figure out what can break the chain as well. But just know this chain of infection is a huge important component in healthcare. if you have all of these different components, then that's how infection spreads. But if you're able to actually eliminate some of these components, then the infection won't be able to spread. So again, it'll make more sense once we get into it. But just remember, you do have this chain of infection. You have these different links into it. And then if a link is broken, then that can help with not spreading the infection. I'll actually go back to this. So I'm just going to give like quick examples of this. You have your infectious agent. So this is going to be what actually causes the illness. So it could be a virus, the name of a bacteria. So let's go through with COVID-19 because it's relevant. So COVID-19 is that infectious agent. The reservoir is where is it basically being hosted. So it can actually be an individual, but it can also be maybe an object, because let's say that person coughed, they touched an object, that sort of thing. But we'll just say it's a person for right now. So you have COVID-19. Now you have that person that's infected with it. Portal of exit is how does it leave that reservoir or that person? So it could be maybe they cough on their hand, they rub their eye, maybe they touch their mouth, and then they touch something. So that mode of transmission is going to be basically how did that next step get touched. So again, if that person rubbed their eye or coughed into their hand, maybe they touched a door handle. Okay, now you have a mode of transmission is on that door handle. Portal of entry then is going to be like the next person almost. So portal of entry could be the next person's like eyes, could be their mouth. So maybe they touch the door handle, they don't sanitize their hands, and then they touch their eye with it. That same hand that touched that door handle that had the COVID-19 virus on it, that's the portal of entry. And then you have this susceptible host. So the susceptible host is now the new person that's been infected. And then it just basically continues. So we'll talk about how you can break up the different links. Like hand washing is huge for the majority of these things. But just know that this chain of infection is kind of just a circle of how things are spread. When it comes to the chain of infection, it's just super important to try to eliminate any step in the chain that you can do to stop the infection. So I talked about how hand washing is super important. Let's say person is infected with COVID, they touch their mouth, they touch some type of surface doorknob. If somebody comes by and wipes off that doorknob and disinfects it, then that can be one way that you break the chain. But just making sure that you're following practices to just break that chain. So again, washing hands, disinfecting, and then just to keep in mind, pathogens are everywhere. So I'm not trying to turn you guys into germ phobes. I know everyone is probably more germophobic now just because with everything that's going on. But just to be aware of it, to make sure that if you are sick, you're staying away from other people. If you realize someone's sick, maybe you're trying to avoid them. And this is not just talking about COVID, it's just about any type of illness. And again, just prevention is important because once we get rid of those people who are infected, not that they're going to die, but just once they become cured and if they're not able to infect other people, then that's how we can kind of stop this spread of infection. And then just know asepsis is a term you will need to know for this class. So asepsis just means absence of disease-producing organisms. So it's just how are you getting rid of those microorganisms, those pathogens that could produce a disease. So you have different techniques. A couple of them we've talked about. So again, making sure you're washing your hands, making sure just in general you have good personal hand hygiene. So, or not just hand hygiene, but if you don't have anywhere that you can wash your hands, you're using some type of alcohol based hand sanitizer, making sure that you're showering as well. If you are coming into contact with people that are potentially infectious, you're wearing gloves. If you're cleaning a wound, which we'll get into when we cover first aid, you're assuming that the person's wound that you're cleaning, they're infected, so you're wearing gloves. Making sure that you're cleaning any instruments, equipment, proper cleaning of the environment. So all of these things are just important to make sure to prevent the spread of infection. And so this is more so, I mean, I know you guys are probably thinking about right now with COVID, but it's in a hospital setting. Cleaning is so big in a hospital setting, and making sure that you're washing your hands all the time in a hospital setting. They have stations everywhere, things like that. So even before coronavirus, this whole thing Super important. And then these terms, just note the difference between the three. So again, asepsis is typically some type of technique that's used on the skin. So that would be your hand washing. Disinfecting is used primarily on objects. So if I'm saying, okay, I need to disinfect this table, that's going to be obviously an object, you're cleaning it. And then just remember, sterilization is actually one of the higher levels of actually killing microorganisms, and that's the use of steam under pressure. And then all of that, basically that heat then just completely destroys the germs. So, or at least up to like 99.9%. So just know the difference between this. Disinfecting is important, but it's not going to kill everything like sterilization will. So I believe that is the end of this slide show. So if you don't have any questions, just make sure you turn in your notes, and then we'll talk about this more tomorrow. And have a good day. Bye.